study we just published, in it we assessed the global burden of household air pollution. That means the impact of particulate matter that comes from using solid fuels for household cooking. These fuels can be coal or charcoal, they can be wood, they can be crop residue or dung. Generally, household air pollution is a quite well-established risk factor with a variety of adverse health impacts that are quite well supported with numerous epidemiological studies. The good news is that household air pollution has been declining over the last decades, but especially in low and middle income countries, there is still a large number of the population that relies on these sources for household cooking. This figure shows us the percentage of population that is exposed to household air pollution. What immediately sticks out in deep red is sub-Saharan Africa. In many of the countries, over 90% of the population are exposed to household air pollution. And then there are other countries such as Sudan, Angola, or Namibia, where the exposure is only between 30 to 50%. In addition to Africa, several countries in South Asia show a quite high percentage of people being exposed to household air pollution as well. So we found that in 2021, 2.7 billion people, that is about 1/3 of the total population, were exposed to household air pollution. On average, the exposure level when using solid fuels for household cooking was 85 micrograms per cubic meter, which is almost 20 times above the WHO guidelines. We also found that about 4% of all disability-adjusted life years could be attributed to household air pollution, and a number of 3 million deaths. Over time, both the total number as well as the rate have been going down by between 35 to 65%, but in areas such as sub-Saharan Africa or South Asia, we still see a really high burden that we can attribute to household air pollution. In India, the largest country in the region, about 50% of the population are exposed to household air pollution. And then there are some countries such as Bangladesh or Myanmar or Laos where exposures are much higher. On average, in East Asia and Latin America and the Caribbean, exposure percentages are more moderate, but then there are countries such as Haiti or North Korea where exposures are really more in line with exposures in sub-Saharan Africa. So there is substantial evidence that household air pollution impacts reproductive health outcomes. Babies that are exposed to high particulate matter levels are born earlier or even preterm and have lower birth weight. Now, at the same time, short gestation and low birth weight can have a multitude of health impacts over the life course. These reach from otitis media to meningitis, encephalitis, sudden infant death syndrome, or other neonatal disorders, as well as diarrheal diseases or upper and lower respiratory infections. In our study, we accounted for this entire cascade of mediated effects and found that about 1/3 of the burden that is due to household air pollution can be attributed to these impacts on adverse reproductive health outcomes. This figure shows us the time trends of populations exposed to a specific fuel type, both globally as well as by superregion. Wood is by far the most common fuel type, with declining trends globally and in all the superregions, especially in South and East Asia. The second most common fuel type is coal. It is globally declining, which is driven mostly by declines in South Asia, but interestingly, it is increasing in sub-Saharan Africa. Dung and crop residue are generally quite rare, with a slightly higher share in South Asia, and we observe very little change over time. So this figure shows us the decomposition of different drivers impacting changes in household air pollution attributable burden over the last 3 decades. Globally and in all superregions, we see a negative net percentage change. That is mostly due to the reduction of exposure in household air pollution, which is shown in yellow, and the reduction in other risk factors, which is shown in green. Population growth and aging, on the other hand, shown in dark and light blue here, are offsetting some of the improvements that have been made on the exposure side.